Welcome to Type 1 Diabetic Warriors. Our team is committed to bringing Type 1 diabetics the latest medical developments to manage this disease. We also cover current medical advancements seeking a cure for T1D. If you value this content, please feel free to show your support by clicking on our homepage and hitting the link to buy us a coffee. Your support helps our team to research topics for upcoming videos. We thank you for your support.
Hello there, Type 1 Diabetic Warriors. Jim here, and I've got a story for you today. Wouldn't it be nice as Type 1 diabetics if we didn't have to think about multiple shots a day? Wouldn't it even be nicer if we had a micro patch the size of a penny that we could put on our bodies with a reservoir of insulin that would deploy as needed throughout the day and possibly up to 48 hours? Well, we have a story today about a company that is working on just such a technology, and we're eager to share that with you. Hit the like and subscribe button so we can reach more people around the world with this valuable information. Now let's find out all about the insulin microchip.
Penny-sized insulin patch. Who is working on it, and where is it in the trial process? One of our viewers recently asked about this topic and inquired about the current status of the process for creating a penny-sized micropatch designed for insulin delivery. Here are the details as of August 2025. The so-called penny-sized smart insulin patch, a glucose-responsive microneedle patch that delivers insulin automatically when blood sugar rises. Who's behind it? Jen Gu's lab at UCLA, collaborating with UNC Chapel Hill and MIT, has been the driving force behind this technology. Their patch is roughly the size of a coin, about a penny or quarter, and contains over 100 microneedles loaded with insulin and glucose-sensing materials. The research team has been applying for FDA approval to initiate first-in-human clinical trials, and the strategy has been accepted into the FDA's Emerging Technology Program. Currently, there is no evidence of completed or ongoing human clinical trials, phase 1 or beyond, for this specific patch. Existing data remains limited to animal models. Additional context. There are other insulin delivery patches and wearables under development, such as patch pump systems like the Luna from Luna Health, which is in virtual phase 2-3 trials in T1D adults as an overnight aid patch. However, that system is not the microneedle smart patch, but rather a hybrid patch pump device that works with CGMs and AI algorithms. Moreover, a broader review of microneedle technology for insulin delivery suggests that while there is momentum and many patents filed, clinical translation remains limited, with challenges around dose control, insertion reliability, material safety, and human feasibility. Here's a breakdown of related patch-based insulin delivery technologies that are further along than the penny-sized microneedle patch. 1. Smart microneedle patch, Gu's team. Type: glucose-responsive microneedle patch. Developer: UCLA, UNC Chapel Hill, MIT. Stage: preclinical, tested in mice and pigs. Key point: designed to automatically release insulin when glucose rises. No CGM or pump required. Next step: FDA approval for phase 1 human trials. 2. Patch pump hybrid devices. These are wearable insulin patches that deliver insulin via a small reservoir and can be paired with CGMs or automated systems. Luna Patch, Luna Health Phase 2-3, recruiting. Overnight insulin delivery aims to simplify basal insulin control for T1D. These aren't true microneedle patches, but are relevant. iLet Bionic Pancreas Beta Bionics, FDA approved, not a patch, but a fully automated AED device. Insulet Omnipod 5, tubeless patch pump, already FDA cleared, widely used in T1D. Bottom line: smart microneedle patch, preclinical stage. Patch pump devices already in late trials or on the market. True needle-free or fully automatic glucose-responsive patches, still several years away from human trials. This could potentially make life easier for Type 1 diabetics. Type 1 diabetic warriors will continue to monitor these technologies as they progress and report back the results for our viewers.
Smart microneedle patches, something in the development pipeline. It's early. However, the good news is, and you can ask your pharmacist if something like the Omnipod 5, which has FDA clearance in the United States, I'm sure it's available in Europe, perhaps in India as well. You can ask your pharmacist and they can tell you if you can get that. Now, the Omnipod 5 has been out for a couple of years, and it is a reservoir of insulin, but it works with a CGM. So you would need both of those. But it's a great way to manage your insulin. I personally have a cousin who is a nurse. She's been diabetic for over 50 years. She uses the pump, and I believe she uses that particular one. And she's had absolutely no complications because she's kept her blood sugars in such tight regulation over the years. So I would check that out. And perhaps your doctor knows about these smart microneedle patches that are in development. Several companies are working on them, but it's something that is in early preclinical stages right now. We're hoping it'll be out there within 4 or 5 years. It would be a great way to manage this issue. Thanks for hanging out with us today. As always, this is the channel for everything type 1 diabetic, and we'll have another video for you real soon. Till then, have a great day.